Hi everyone, good day to you, good day to everybody. I hope your day is going extra well. As in, for me, it's fine. I woke up feeling good. The joy of the Lord is upon my heart. So I rejoice in the day that the Lord has made. Welcome to my YouTube channel. My name is Shannon Malia. Don't forget to subscribe and also hit that notification button so that whenever I upload a video, you're actually notified, and then you're going to follow that video and also learn from it. To begin with, today we're actually going to talk about a topic that we find in mental health and psychiatric nursing, which is aggression. Aggression. We need to know what this uh, condition is all about, or what this topic is all about. After that, we're going to actually know the general thing, what it involves, how to manage it. You know, this is actually in mental health. So please, I need your attention. I need your attention. I may be a little bit fast or slow, however way you need to be following. At least we should be moving at the same page. Welcome once more. And our general objectives is that students should be able to know how to actually manage a patient with aggression, and also to know what this condition is all about. So we're going to define what aggression is. We're also going to actually state the five predisposing factors or five risk factors of aggression. We're also going to look at the three types of aggression, major three types of aggression that we have, and then we're also going to look at a few stages that are involved in there, and then also going to talk about a few things when it comes to management. So please stay tuned, keep following the video. So those are our specific objectives. However, I'm going to begin. So in defining, we are saying aggression, this is any behavior that a person portrays which is intended to cause harm, which can be either causing harm to others or causing harm to themselves. So most of the time we find that these people that are aggressive, they may end up harming themselves. If not themselves, they actually be harming the people around them. However, they like occupying other people's personal spaces. They don't mind their rights. All they have to do is just to infringe their rights, cause harm, and all those things. So that is the definition of aggression. Coming to predisposing factors or risk factors of aggression, these are, we have a lot of factors, of which I'm just going to outline the five of them. The first one, you're going to say, let me say, biological factor. Biological factor, we are saying this is whereby aggression happens to run in families. Maybe the father was aggressive, the grandfather was aggressive, and then this child grows up and then they tend to be aggressive too. So it may run in families. And then coming to biomedical, we are saying that aggression, there are people who are living with chronic conditions, it's stressy for sometimes. Maybe you are bedridden for years, maybe they amputated you and you can't just stand the fact that you can't walk anymore. And you find that these people, at the end of the day, they in their grieving process, they tend to be aggressive at some point. Under stages of grieving, we know that there is a stage where we talk of anger. When someone is angry, they may try to be aggressive. They may insult, they may try to beat you up, they may try to yell at you, all those things. So biomedical, this can lead to aggression, when patient is having a chronic condition. They may at times lose temper, they may at times lose hope and then become aggressive. And then coming to another factor that we have is environmental factor. That is the third one. So under environmental factor, we are saying that, if you live in an environment whereby there is alcohol abuse, there is drug abuse, everyone is just insulting, they're just beating each other, using some abusive language, there is a chance that one may end up becoming aggressive too, because of the environment that they live in. Maybe in your house, your father and your mother, your guardians, they like fighting, they like yelling at you. All those things may lead one to developing aggression. And then coming to the fourth factor, which is a psychosocial factor. Psychosocial factor, we are saying that these are things that affect us mentally, as we grow. Let me say, maybe I was being ill-treated by my guardian as I was growing up, and then I develop these traumas in my head. I grew up, I don't even understand what life is, and I just feel like being aggressive is the way of life. So that may lead to aggression too. And then the fifth factor that we have is psychological factor. Psychological factor, we are saying that there are people who experience, we all go through things, we all go through stuff. I may lose a loved one, I may lose a job, I may lose property, all those things, you are stressed. At the end of the day, it may lead you to being aggressive. So when we look at psychological factor, we're actually talking about stressful events that take place in our lives and then lead us to what? To aggression. And then we have the sixth one, that's just an additional. We are saying that we have, which is a psychiatric factor. We find that most patients that have got mental conditions, due to changes in their neurotransmitters, in their biochemistry, we find that these people at some point, they may be aggressive. Maybe a patient is just seated on their own and then you just pass, they end up slapping you. That's being aggressive. We find that the cause of that thing is because of their mental condition. Not that they really wanted to be aggressive, but it's because, their thought processes, all those things led them to aggression. And then coming to, I think those are the risk factors, and we're done with that. And then we have stages of aggression. We have stages of aggression. So coming to stages of aggression, they may ask you, NMCZ may ask you to outline the 5 stages of aggression. So we have the first one, which is triggering phase. The second one is escalating phase. The third one is crisis phase. The fourth one is recovery phase, and then the fifth one is the post-crisis phase. So what do we find in triggering phase? This is whereby we find that I'm exposed to a stressful event, or let me say I'm exposed to any trigger that may lead me to actually become aggressive. For example, maybe I just hear that someone else was talking about me, that would trigger me to become irritated. I may feel agitated. I may feel, like my heart will start beating fast. Someone may end up having tachypnea because I have heard something. So that thing that I've heard is actually triggering. It's a triggering factor that has led me to feel the way I'm feeling. From there, we move to the next stage, which is escalating phase. So escalating phase, this is where by now some, levels of anxiety begin to increase. I may lose my mind a little bit. Most of the times we find that we can't even think clearly at this stage. I may start yelling. I may start maybe, all those things that one may feel like your temper may increase. You may start shouting, all those things. So escalating phase, we're just talking on the issue whereby you now feel it's coming out of hands. You're no longer just angry, but you feel like you need to act. Towards what you have heard or towards what you've been exposed to. And then coming to crisis phase, this is the third one, whereby now you now act, you respond. It can either be verbally or it can either be physical, whereby you end up beating people or beating someone. You may yell at them, you may punch them, you may spit at them, you may bite them, whatever you may do. That is crisis phase. You're now you can't think clearly, and all you are doing is to act out of way. So that is crisis phase. And then we have recovery phase. So under recovery phase, we're saying that the person now has actually recovered from their emotional and physical, they weren't too well at that point when they were in crisis phase, but here we find that someone is calm, they no longer have that tachypnea, they realize that, they acted out, all those things, they are calm. Even the muscle tension, they'll be just relaxed. So that is the recovery phase. The patient recovers back to their normal state. And then post-crisis phase, we are saying under this is whereby, let me say, I begin to regret now. What did I do? Maybe I tried to reconcile with that person. Please forgive me, I just lost my temper, all those things. So it's just a matter of trying to put things in order and trying to ensure that you are in good relationship with those that you had offended or those that you had acted out. So those are the 5 stages of aggression. And then coming to 3 types of aggression that we have. We've got many other types of aggression, but we're going to pick these 3 major types. We have the first type, which is relational aggression. This is whereby, let me say, I hear someone gossip about me. It's something whereby it's a type of aggression which is found under peers, let me say maybe adolescents, or even in workplaces. This is just a type of aggression whereby you get out of hand. Maybe I told you a secret, you happen to just go out there and then spread that secret, and then I'll end up becoming angry because you did what? You had to share something that was actually something that I just told you to be a secret. So it's something it's just something to do with relationships. It can either be with your friend, it can either be with your family, it can either be with your partner, however way. And then coming to the second type of aggression that we've got hostile aggression. So under here we are saying that this is the type of aggression whereby someone is trying to cause harm to others. They are trying to put harm or inflict pain on others. So you find that they're not only trying to occupy their space by accident, but they really mean it. They really want to cause that harm. So that is the hostile aggression. They just want to be hostile. They just want to be against other people's rights. That's the type of aggression that we have. And then we have the last one, which is instrumental aggression. Instrumental aggression, sometimes it's not that person really wants to cause harm to you, that person really wants to insult you, that person really wants to do something. It's just that they just want to get something. Maybe I just want to get a position, all those things. I just want to get some, you yourself, who, let me say, maybe I get your I don't know the example I can give, but it's all about, maybe I just want to get some stuffs from that person. I don't really want to cause harm to them. So that is instrumental aggression. So we've defined what it is. We've talked of the risk factors. We've talked of the stages. We've talked of the types. And now, how do we manage a patient with aggression, or how do we manage a person with aggression? So on the ward setup, we find that these people, when they bring them, some of them may be in chains, some of them, they may just be walking but insulting, all those things. So you, as a nurse on your ward or at your filter, at Chainama, they usually bring these people at filter ward. That's where, at filter department, it's more like an OPD, outpatient department, but after that, the patient may be taken to the wards until they stabilize. So you find that we need to bring that person in order. They can't just be beating people. So at least you need support from other nurses or from other health workers that are in that department. You need to restrain that person. At least if they can't be calm just by telling them verbally, you can even use any major or minor tranquilizer. You inject them, at least they should be calm. After that, you take them to the wards. If at the wards they keep being aggressive, you put them in seclusion. Where they are isolated on their own until they stabilize. So there is a lot, in mental health when it comes to management. Is something for the day. So those are just a few things. And as a nurse on the ward setup, if you are, let me say, maybe in an exam they tell you to write 5 measures that you can put in place in order to prevent aggressive episodes on the wards. What you have to do is you need to at least outline very well in your exam. One of the things that we can do is that you need to maintain a good relationship with that person. You need to improve your communication. You can't be yelling at that person, they end up beating you up. You can't be just calling them names, they end up beating you up. So you need to create a good relationship. You need to have active listening. You need to have good communication skills so that you'll be able to communicate well with that person. After that, you can also ensure that it's a calm environment. You need to put that person in a calm environment, or that patient in a calm environment. Noise can be a trigger sometimes. And then another thing that you can do to avoid these aggressive episodes, even as staffs, we must be trained on how to manage aggressive patients. We must have that skill on how to manage aggressive patients. Not only that, but we also need to have emotional intelligence, whereby we need to control our emotions. These people, they insult. They can even insult your mothers, your grandmothers, however they think of insult, or however way they'll think of insulting you, they'll actually do that. But you as a staff, you're not supposed to insult back, you're not supposed to be angry, but you need to have emotional intelligence on how to control your own emotions. So those are a few factors that you can put in place. Another thing, you need to be checking up on that patient regularly, so that you check if at all they are calm, or they are still aggressive, all those things. So those are a few things that we can talk when it comes to this topic, aggression. Thank you so much. If you've got a question, don't forget to just ask in the comment section. I'll actually attend to it at my free time. And then you can also share the video. Don't forget to like, nevertheless subscribe, and also hit that notification bell to ensure that when I upload the next video, you'll be updated, and then you'll be able to learn one or two things. Thank you so much for your attention. See you in the next video.